I'm Sai,
My name is Eva.
and we're health science students. Today we're going to be demonstrating PROM exercises. PROM stands for passive range of motion.
And it's to prevent stiffness for patients and also improve joint stability as well as blood circulation.
PROM exercises are usually used when in initial stages of healing after surgery or injury, or for individuals with paralysis or long-term immobility.
And in this video, we're going to demonstrate 5 exercises for hips, knee, wrist, elbow, and shoulder.
So let's start with the shoulder exercises. For a shoulder exercise, I'm going to support her arm at her wrist and the elbow. I'm going to stretch her arm up. This is flexion, and then bring it back down. This is extension. Flexion, extension. Flexion, extension. Next, I'm going to move her arm away from her body. This is abduction, and then towards her body, this is adduction. Abduction, adduction. Next, we're going to position her elbow 90 degrees to her shoulder. Next, we're going to put her hand down. This is internal rotation, and then back up, external rotation. Internal rotation, external rotation.
Okay, next we're going to move on to the elbow. So I'm going to support her upper arm and gently bend the elbow to her shoulder. So this is flexion, extension. Flexion, extension.
Now let's demonstrate the wrist. For her wrist, I'm going to support her arm by holding the forearm. I'm going to move her hand forward like this. This is flexion, extension, and all the way back is hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Next, I'm going to move her wrist towards her thumb. This is a radial flexion, and towards her pinky is ulnar flexion. Radial flexion, ulnar flexion. Radial flexion, ulnar flexion.
Okay, we're going to move on to the hips. These are going to be the same exercises as the shoulder. I'm going to gently lift her leg and place my hand under her knee and ankle. Then I'm going to move her leg towards her chest. This is flexion, back down, extension. Flexion, extension. Then I'm going to move away from her body. This is abduction, adduction. Abduction, adduction. Then is internal rotation and external rotation. Internal rotation, external rotation.
Now lastly, let's do the ankle. To do her ankle, we're going to support her foot by holding her ankle and the bottom of her foot. We're going to pull forward. This is plantar flexion, and then push back. This is dorsal flexion. Plantar flexion, dorsal flexion.
Some common mistakes while performing PROM would be moving the joint too fast, or moving the joint past the point of resistance, hurting the patient, failing to communicate with the patient, or failing to hold the limbs properly. For patient comfortability, make sure to explain what you're about to do. Make sure that the patient is positioned correctly. Make sure that the patient is relaxed. Use slow and steady movements when performing the exercises. And remember to check in with your patient at all times if they're feeling okay or if they're feeling any pain. And if they're feeling any pain, make sure to stop immediately. Thank you for watching our video. We really hope this helps your ROM exercises. Thank you.